Another cause of immune weakness, or cause of susceptibility to infection in general, or to a more severe infection when you get the infection, are nutrient deficiencies. Now, there's sort of the myth running around that Americans aren't malnourished anymore, that people used to be malnourished during the Great Depression, but that nobody's really malnourished anymore, and this is absolutely not true. Since the 1970s, the National Institutes of Health has been doing periodic evaluations of the nutritional status of North Americans, and it's almost impossible to find a person living in the United States who isn't deficient in one or more nutrients. Now, there are certain nutrients, critical nutrients, that are involved in immunity and having a healthy immune system. Now here, if you have normal nutritional status and you take these supplements, it won't increase your nutritional status, right? But if you're deficient in some of these nutrients, then your immune system won't work properly, right? And when you start to supplement them, it will bring your immunity up to normal. What we're looking for here, the acronym is ZACES, Z-A-C-E-S, and that would be Z for zinc, A for vitamin A, C vitamin C, E vitamin E, and S is selenium. And the sixth nutrient is our omega-3 fatty acids. This is what you find in fish oil, and you could find those in fish oil capsules, or cod liver oil at the health food store would have essential fatty acids. And the cod liver oil would also contain the vitamin A, so that's the A of ZACES there. Reason why modern people might need these are studies. Up to 50% of Americans are deficient in zinc. Up to 30% of children in North America are deficient in vitamin A. Vitamin A deficiency isn't very common in adults. Not more than about 1 in 20 adults are deficient in vitamin A. Vitamin C, about 20% of the population is severely deficient in vitamin C, and the majority of the population have suboptimal levels of vitamin C to the extent that it affects their immunity. Vitamin E, about 90% of the modern population fails to consume the recommended dietary allowance of vitamin E, or the optimal amounts of vitamin E. And finally, about 50% of Americans are deficient in selenium. You won't find a lot of people who are deficient in all of those, but you'll find most people are deficient in some of those. So a very good prophylactic regime for that would be to take about 20 milligrams of zinc a day. You could take the vitamin A in cod liver oil, or take 1,000 IUs of vitamin A as retinol, or you could take 10,000 to 25,000 IUs of vitamin A as beta-carotene. You'll see that on the label of a vitamin supplement. Take about 100 IUs of vitamin E. Take about 500 milligrams to 1 gram of vitamin C a day, and take about 200 micrograms of selenium. And those amounts are not excessive. That's not megadosing, and those amounts will restore the empty nutrient reservoirs in people who are deficient, and it will help optimal immune functioning. There are some herbal remedies that would be available at almost any herb store or any health food store, and the most famous herbal remedy in North America over history, it was a medicine. It was learned from the Native Americans, and that this had been used by medical doctors in every epidemic between 1760 and the 1918 epidemic, and found to be useful by those doctors. And that herb is called boneset. The Latin name is Eupatorium perfoliatum. So during flu season, small doses of boneset may be useful to prevent you from getting the infection, or allow you to get the infection and only have a very mild result. This was actually tested during the 1918 flu. It was in Philadelphia. There was a factory in Philadelphia where 4 workers were stricken by that flu. And of course, everyone was terrified, because in the cities at that time, up to 1/3 of the people who got the flu in the cities would die of that flu. And so one of the local doctors arranged with a company, and they got a large amount of this boneset tincture, and they gave it in the dose of about 10 or 12 drops a day, 4 times a day, to all the people in that factory. And they said no one else in that factory got the flu, even though 4 workers had been in there, and it would usually have spread through there like wildfire. The other herb, and this has been used traditionally throughout most of recorded European and North American history, is called elder, elderflower, Sambucus nigra, and this can be elderflower or elderberry. And there was some research, and a researcher from Israel, Dr. Mumkwaglo, did some clinical trials, and this was actually, they tried this in patients with influenza, and they were randomized clinical trials, and they, one group got a placebo, one group got a preparation of elderberry in a syrup form, and the patients who got the elderberry syrup, the influenza, they gave this once they were infected with influenza. The influenza was milder. They were almost all completely done with their fever by the 2nd day, and they had way less severe symptoms of influenza. Probably by now, all the herb companies in the country have an elderberry syrup, and you can find elderberry syrups for sale in most health food stores in North America. Now, one of the principles we use as medical herbalists is in epidemic disease, what's good for treatment is good for prevention. So both boneset and elder have been used to treat influenza by physicians, medical level herbalists in North America, also in England. And, but also smaller doses can be used, say at the height of flu season. Somebody in your workplace has gotten the flu and you think it's going to spread through the office. You can take small doses of those herbs. And then if you actually get the flu, increase those. I would say one thing, I'll close here. After the 1918 flu, the Johns Hopkins University looked back at the cases and all the different treatments people had tried out and were using to treat influenza, and they wanted to see what worked the best. And they only found one thing that predicted survival, predicted mild disease and predicted survival from that flu. And that one thing, their quote was, whoever went to bed the soonest, stayed in bed the longest, and had the best nursing care was most likely to survive. Right? And I would say from my own experience, I've been treating flu since the 1970s with herbs and nutrition. And I would say the very most important thing to understand is that influenza is a disease that lasts 7 days. And if you get the flu, stay in bed for 7 days. Or you can get up and putter around the house on day 5 or 6 or something if you're feeling better. But don't go back to work, don't go back to a stressful situation, because the immune response to that herb, to that virus, continues to come in waves, and those waves continue to come on day 4 and 5 and 6. And those immune responses, they're called, they call them, medically, they call that a cytokine storm. And you can have cytokine storms, you think your influenza is over, and you can have a big wave of inflammation in your respiratory tract on day 5 or day 6, even though your fever went away on day 2. And I'll close again talking about vitamin D. This is one of the other roles of vitamin D. Vitamin D increases immunocompetence in the respiratory tract, but then vitamin D also puts a brake and reduces the severity of what we call cytokine storm. So it can reduce the severity of the inflammation and damage to the respiratory tract in influenza. So thank you very much.